post-traumatic stress disorder, PTSD, and substance abuse frequently co-occur, creating a complex and challenging dual diagnosis. Individuals with PTSD may turn to substances as a way to cope with their symptoms, leading to a cycle of addiction and worsening mental health. This chapter explores the relationship between PTSD and substance abuse, discusses the challenges of dual diagnosis, and highlights integrated approaches for effective recovery. The relationship between PTSD and substance abuse. Self-medication hypothesis. The self-medication hypothesis is a primary explanation for the co-occurrence of PTSD and substance abuse. This theory suggests that individuals use drugs or alcohol to alleviate their distressing symptoms, such as anxiety, insomnia, and intrusive memories. While substances may provide temporary relief, they ultimately exacerbate the symptoms and create additional problems. The cycle of self-medication can lead to increased dependence on substances and further deterioration of mental health. Neurobiological factors. PTSD and substance abuse share common neurobiological pathways. Both conditions affect the brain's reward system, leading to alterations in dopamine levels. These changes can make individuals more susceptible to addiction and increase the reinforcing effects of substances. The interplay between trauma-related stress responses and substance-induced changes in brain chemistry can perpetuate the cycle of addiction and PTSD symptoms. Social and environmental factors. Social and environmental factors, such as trauma exposure, stress, and lack of social support, can also contribute to the co-occurrence of PTSD and substance abuse. Individuals with a history of trauma may be more likely to engage in risky behaviors and have limited access to healthy coping mechanisms. The presence of environmental stressors and the absence of supportive relationships can exacerbate both PTSD and substance use disorders. Challenges of dual diagnosis. Increased symptom severity. The presence of both PTSD and substance abuse can lead to increased symptom severity. Substance use can intensify PTSD symptoms, making it more challenging to manage the condition. Conversely, PTSD can drive individuals to use substances more frequently, creating a vicious cycle. The interaction between the two conditions can result in more severe mental health and functional impairments. Treatment complications. Dual diagnosis presents unique challenges in treatment. Traditional treatment approaches for PTSD or substance abuse may not be effective when both conditions are present. Integrated treatment plans that address both issues simultaneously are essential for successful recovery. The complexity of dual diagnosis requires specialized interventions that consider the interplay between trauma and addiction, stigma and barriers to care. Individuals with dual diagnosis often face significant stigma, which can prevent them from seeking help. Additionally, they may encounter barriers to care, such as limited access to specialized treatment programs and a lack of trained professionals who understand the complexities of dual diagnosis. The stigma associated with both mental health and substance use disorders can create additional obstacles to accessing appropriate care. Integrated approaches for recovery. Integrated treatment programs. Integrated treatment programs that address both PTSD and substance abuse are crucial for effective recovery. These programs offer a comprehensive approach, combining therapies that target trauma and addiction. By treating both conditions simultaneously, individuals have a better chance of achieving lasting recovery. Integrated programs provide a coordinated and holistic approach to care, addressing the multifaceted needs of individuals with dual diagnosis. Trauma-focused therapies. Trauma-focused therapies, such as hypnotherapy, cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, are effective in treating PTSD and can be integrated into substance abuse treatment. These therapies help individuals process traumatic memories, reduce PTSD symptoms, and develop healthier coping mechanisms. Incorporating trauma-focused interventions into substance use treatment can enhance overall outcomes and promote long-term recovery. Medication-assisted treatment, MAT. Medication-assisted treatment, MAT, can be beneficial for individuals with dual diagnosis. Medications such as naltrexone, buprenorphine, and methadone can help manage substance cravings and withdrawal symptoms, making it easier for individuals to focus on their PTSD treatment. MAT, combined with psychotherapy and support, provides a comprehensive approach to addressing both substance use and trauma-related symptoms. Support groups and peer support. Support groups and peer support programs provide valuable social support and a sense of community for individuals with dual diagnosis. These groups offer a safe space to share experiences, receive encouragement, and learn from others who have faced similar challenges. Peer support can foster a sense of belonging and provide practical strategies for managing both PTSD and substance use disorders. Case studies illustrate the complexities of dual diagnosis and the benefits of integrated treatment. One case involves a veteran who used alcohol to cope with PTSD symptoms. Through an integrated treatment program that included EMDR and MAT, he was able to reduce his alcohol use and manage his PTSD symptoms more effectively. Another case involves a woman with a history of childhood trauma and opioid addiction. Integrated treatment, combining trauma-focused therapy and MAT, helped her achieve sustained recovery and improved mental health. PTSD and substance abuse often co-occur, creating a complex dual diagnosis that requires integrated treatment approaches. By addressing both conditions simultaneously, individuals can achieve more effective and lasting recovery. Trauma-focused therapies, medication-assisted treatment, and support groups are essential components of a comprehensive treatment plan. Understanding the relationship between PTSD and substance abuse is crucial for providing the support and care needed to help individuals heal and thrive. Integrated approaches offer hope for recovery and the possibility of a healthier, more fulfilling life.